From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
We are back with our sponsor today, Baptist Health, and in this month's Keep On Amazing, Dr. Sheffield Kent is here along with his patient, Rita Underhill, to talk about chronic back pain and, more importantly, a new treatment that can relieve that pain. Welcome. Good to have you. We'll get your story in just a second. Let's start with the doctor. What is this new treatment?
Today we're going to talk about spinal cord stimulators.
Okay.
Now, these are medical devices, not unlike a pacemaker, that uses tiny amounts of electricity to treat chronic pain. This is a drug-free therapy, and we use it for all types of pain, mostly back pain, but also leg pain. We also use it for patients that have had back surgeries but still suffer with chronic pain.
Right.
Now, about 80% of Americans will deal with chronic back pain at least one episode during their life. So this is something that affects a lot of us.
Certainly does. You brought basically the device and can kind of show us how it works?
I did. So these devices, you know, they're for people that have kind of tried about everything else. They've tried medications, physical therapy, maybe injections, and possibly even surgery. It's a little implantable device. You can see the batteries here. They're very small. Now, we don't put anything like this in the body unless we know that it works. So we do a 1-week trial period where we place the leads, just like doing an injection in the office. The patient gets to go home, live their life, and just come back in a week and tell us, did this make a huge difference for us? And if it did, then we offer them the implant. So the fact that you get to try this device is very unique among medical therapies. The implant itself takes about 45 minutes to do. You go home the same day, and people can start noticing relief almost instantly.
Really? That soon? Yeah, so tell us about what kind of pain you were having, Rita.
Well, I've had chronic pain for a number of years, and I had done back blocks and different treatments like that.
All the things he mentioned.
Everything that he mentioned for about the last 10 years or so. And so then when I started seeing Dr. Kent, we started doing blocks again, but they were getting shorter and shorter duration between them. And
is that injections? Is that what a block
is?
Okay.
Yes, we were talking about epidural steroid injections in this case.
Right. And so it was getting shorter and shorter space between them, which is not advisable.
Yes,
really,
not working as well, and you can't overdo those.
Right,
correct?
Absolutely. It's not something we want to give you too much of.
So when I did the trial, I knew right away that I really wanted it because it was immediate. It really is immediate. It's kind of funny sounding, but it really is.
So you were sent home, like you said, without it implanted first.
Right, for a week. And that's kind of funny, but then once they take it away, you know that you really want it back.
Yeah, you're like, okay, I'm sold. I'm sold on this. So talk about the procedure and how quickly, did you get over that? Was that easy?
The procedure, like he said, was for, you go in for a day's surgery, you're back out immediately, and you can pretty much do anything once the anesthesia from that wears off.
Is that what you tell patients? They're back at it?
We like to keep them with some limited activity restrictions at first, just because you have had a minor procedure and there is some soreness with that. But I saw Miss Underhill at her 1-week post-op visit, and she was doing phenomenal.
Yeah.
So we're just really pleased.
What are you able to do now that you couldn't before?
Well, other than I'm still not supposed to lift stuff and things like that for a few more weeks.
Yes.
Although I kind of cheat sometimes. I can do everything that I normally do. I mean, the only downside to it, I think, is having to turn it off when I drive.
Oh, okay.
Other than that, it's
right.
okay.
You have to remember to do that.
Yeah, exactly.
So, and is that you don't want it delivering anything while they're driving?
It just depends on the waveform that you're using. With the particular waveform that she likes, we do not advise to have that on as you drive. There are some newer waveforms where you actually don't feel anything, and then it's okay to drive it.
Very good. So for people out there who are thinking about this, but they're a little nervous, what would you tell them?
I would definitely recommend it if their doctor thinks that would do for them.
Right.
I don't take anything for my back, so it's pretty amazing.
Fantastic.
It really is.
Does insurance cover this?
It does. Most insurance, including Medicare, covers this.
Okay, very good. So if you are curious about this, and I know a lot of people with back pain that are looking for anything that will work, and if you think this could possibly be something that you would like to just try first, I mean, that is amazing that they can try it before
unusual.
surgery. Okay. Okay, you can always contact Baptist Health to find out more about it. Of course, their Baptist Health helpline is open for you, or just give them a call and they can set you up for just kind of a routine exam first of all. Consultation to see if this is right for you, or maybe for someone in your family. Here's the information on your screen. Miss Rita, thank you so much. From Conway now. Moved here from Memphis. So thank you for telling us your story. And thank you, doctor. We appreciate it.
My pleasure.
Okay, great advice.